Welcome back. It is a stressful time, and the stress can take a toll on those who are trying to have children. In today's Health Matters, Dr. Zen has some tips for those trying to conceive at this time. Dr. Zen, can I say that you are the Zen doctor to help people have babies?
Yes, absolutely.
So I know at this time people are stressed out, especially couples, and especially those that are, of course, wanting to have children, and you're here to help, which is really great. Are you seeing more cases where people are having trouble conceiving?
Yes, we are. So typically about 1 in 8 patients will actually struggle with fertility in their childbearing years. The problem that we've been noticing in the last 15 or 20 years is that younger and younger patients, so patients that are in their 20s and 30s, are actually experiencing infertility in the same regard as 30, 40-year-olds.
So I know right now you are saying, let's not be embarrassed about this. It takes 2 to tango, so it takes 2 to come see you so that way you can help out build their families.
Absolutely. So it's a misconception that only women are the problem when it comes to infertility. So about 1/3 of cases are actually caused by female factors, another third from male, and then the last third is actually a combination of male and female. So if you can come in as a couple, it makes it so much easier.
So what do you recommend couples to do today?
So one of the things that you can do today is really focus on diet and lifestyle. We're noticing that younger and younger patients are struggling with fertility, and we're noticing that it's related to lifestyle habits and your diet. So definitely focusing on what you're eating and how you're eating matters. Intermittent fasting is one of the most common trending diet therapies, but it actually may not be indicated if you're trying to conceive. I've seen patients who have struggled with ovulation and fertility in general. So definitely watching what you eat is going to be important.
So, and I understand exercising is very important, and also the type of exercise that you do.
Yes, exercise can be really helpful. So 30 minutes a day, 5 days a week is the best. Rigorous exercise, so that's something that, like high intensity workouts, can make a big difference when it comes to situations like PCOS, which is polycystic ovarian syndrome. It's the most common cause for female infertility.
So, okay, there's testing that, of course, you can do. What are some of the tests that you take your patients through?
Yes, there's a variety of tests. Actually, one of the most simple things that you can do as a patient from home is ovulation predictor kits. You can buy them at your local pharmacy, on Amazon. They can give you great information on your ovulation and your fertile window. So this is something easy. Then we can do mobile phlebotomy draws so that you don't have to come into the office, as well as some urine testing when it comes to hormone testing. So there's a lot more options when it comes to doing it from home.
Okay, everybody's been reading, they've been studying, and they've been getting worried, but is it safe to get pregnant right now with the COVID-19?
This is a great question. When it comes to COVID-19, it's still a relatively new virus, so we need to know that the studies are short-term. We don't have long-term studies. The other thing that's really important is if you do get pregnant during this time, you are automatically considered high risk. So it's just something to be aware of. Your doctor may require you to stay home a little bit longer. You also may deliver in a different way. You may not have your partner. Hospitals are trying to avoid as many additional people at the hospital as possible. So just knowing what you're getting yourself into is important.
So, and I know right now a lot of people have been changing how they're seeing people. You have your Zoom calls, your Skype calls that you're saying you're ready to, of course, meet people that way before they come into the office. So how can people get a hold of you?
Yes, you can always make an appointment with me. I offer free consultations as well. So if you're interested in kind of the services that I offer, you can come and visit my website at nmdwellnessofscottsdale.com. You can also find me on Instagram at Dr. Zen NMD.
So, Dr. Zen, thank you very much.
Thanks so much.